The first one will be a brief update by me on the Arctic Mental Health Working Group activities. And I think I want to go ahead and share my screen just to highlight the working group's website. Don't know how many of you are familiar with that group, but this is from the Arctic Research Policy Committee, the Arctic Research Commission. And they are a small independent agency that basically helps to inform Congress and the President on different aspects of Arctic research. They do this through a number of different mechanisms. One way is through different working groups. They have several now, and the one that I'm going to focus on right now is the Arctic Mental Health Working Group. Hope everyone can see the main landing page. Let me move over here. And it gives you the mission, a few of the areas of focus with respect to what their activities are. Can everyone see the same? Someone confirm that they're seeing? No.
I'm getting black.
I got a white stripe down the middle.
Oh, a white stripe.
Right. So now there's,
I did. Yes, I can see it now.
Oh, okay. All right. Maybe I just got to keep it on one particular screen here. Still learning these new monitors. Okay. So again, this Arctic Mental Health Working Group is really focused on strengthening systems of care. And the initial sort of scope was preventing suicide and improving mental health in the circumpolar north. Beneath the main image in the middle of the screen, there are several areas of focus, and they've had usually they create several subcommittees or subgroups that focus on particular areas. They meet on a quarterly basis. The last meeting was in August, so just last month after the International Congress on Circumpolar Health, which the lead coordinator, Dr. Cheryl Rosa, attended and provided updates on the working group. And essentially, these quarterly meetings basically is a way to share information, summarize different progress. In this latest meeting, which I couldn't attend, but one of my former colleagues from NIMH attended, they focused on a couple of different things. One was preparing for the upcoming Alaska Public Health Summit, which will be in January. You know that they are accepting abstracts for sessions through October this year. And so they are preparing, I believe, a proposal to provide some of the information that based on the work that they've conducted this past year. The working group comprises multiple individuals from different state, federal agencies. Dr. Cody Chip is part of the working group. He's now at the Alaska Native Tribal Health Consortium, and he talked about their rural healthcare coordinator program, which helps to essentially increase access to care for individuals who are in need of additional behavioral health services. One of the other things that was mentioned at the meeting included a few months ago, actually right before my departure from NIH, was a meeting on Alaska Native Genomic Research Workshop, which was co-hosted by South Central Foundation and the NIH, and members from my former office attended. And this was a really good opportunity for the NIH. There were, I think, representatives from 8 different centers, including the Office of Director and the Tribal Health Research Office, that met with Alaska Native communities and other service providers from the state to discuss opportunities and interests for conducting genomic and clinical research. Certainly there's been a poor history in terms of how those data have been utilized in the past, and it was really kind of a getting to know one another, understanding what the different priorities and ways in which those data can be used to improve health services for the state of Alaska. So I think that was a valuable point of engagement. This had actually followed a meeting from leadership from South Central Foundation that I attended prior in Bethesda, Maryland, where they were coming to the NIH to really identify and lay out some of their specific priorities. So I think I'm happy to see that type of engagement is continuing. The remainder of the meeting for the working group were sort of brief readouts from some of the subcommittees. There's a data integration subcommittee. They are focused on collecting, integrating, and analyzing different sorts of data, kind of an epidemiological perspective. And one of their next areas of activity is reporting on the violent death reporting system at their next meeting. I think some of the other subcommittees had not really done too much over the summer period, as it can be very, very busy and difficult to achieve much with many people away or on different obligations. But they did identify a couple of areas where they wanted to move forward in this coming year. One was increasing the number of Alaska Native representatives on the working group. This was a comment and feedback that the group had received both at the International Congress for Circumpolar Health and through other outreach activities within the state of Alaska, and also to actually develop a community engagement plan. I think it varies with respect across the state of Alaska, the familiarity that different communities may have with the Arctic Research Commission, the working groups, and what they're setting out to do. And so I think there was another call really to help improve that community engagement such that there is better information sharing based on what the activities of what the working group does and how they can best align with the needs of the different communities. And one other area, actually two other areas that are sort of in development, I believe, for the working group include a climate change and mental health working group, as well as something that referred to as knowledge translation. This was something that Canadian colleagues have seemed to be working at a more advanced stage in the U.S. with respect to, I think, the conventional research that is supported by funding agencies, and then actually converting it or translating it for local and community applications. And so the Arctic Mental Health Working Group also intends to increase their activities around knowledge translation. I believe they intend to create a small working group or a subcommittee of the working group. So in any case, for those of you interested in learning more about this, feel free to reach out to the Commission, Dr. Cheryl Rosa, who's based up in Anchorage. And yeah, and any further follow-ups can go to her. Does anyone have any comments or questions on that? All right, moving on to the next agenda item. I'll take a few minutes to look at or tell you about the Rising Sun Toolkit. Can everyone see this, the Rising Sun page now? Okay, actually, let me switch over to the older NIMH Rising Sun page. So for those of you who aren't familiar with the Rising Sun, this was an initiative under the U.S. Chairmanship of the Arctic Council, which was between 2015 and 2017. It was the basis of my work at the NIH when I moved over there in 2015 to coordinate this activity that was meant to develop a series of community-based and prioritized outcomes for evaluating suicide prevention interventions across or in Indigenous peoples of the Arctic. And if you go to this, you can just search Rising Sun NIMH. It'll give you this landing page that provides an overview. It was a follow-on activity to what the Canadian chairmanship had begun in 2013-2015. This includes a list of the partners and sponsors. It was not just a U.S. government-wide effort, including SAMHSA, CDC, State Department, but also an international effort with the Canadian Institute of Health Research, the Danish National Institute of Public Health, and the Norwegian Institute of Public Health, plus subsequently the Inuit Circumpolar Council was added on. But really was, I think, a comprehensive, wholehearted, very labor and time-intensive effort to engage a broad range of stakeholders, including clinicians and community members, policymakers, researchers, in this effort to identify outcomes for evaluating interventions. And the way this worked was a series of meetings that are sort of summarized here. If you go to the hyperlinks, there are summary reports of those meetings. And there was also an iterative qualitative process known as the Delphi method, where a small steering group sent out open-ended questions and then more targeted questions to hundreds of panelists, participants from the diverse range of sectors. in getting a response to how what are the types of outcomes that are important to evaluate those interventions, as well as prioritizing them in terms of their effectiveness and feasibility and relevance. At the end of the day, there were two important products. One was this online toolkit, which took quite a bit of time to put forward. And this is hosted by the Mental Health Innovation Network, which is out of the London School of Hygiene and Tropical Medicine. And the toolkit has a number of different features. I can just show you a few sort of the highlights. See that the landing page is just, well, you can search MHEN Rising Sun, and it'll lead you here. It's one of the first collaborations. And this is a really neat portal that has different types of resources available to the global mental health community, not just global mental health community, but mental health community at large. And so, for example, the first sort of panel tells you about the toolkit, a little bit more of the history in terms of what it means as an innovation. It also relies on information based from the previous Canadian efforts, which identified different promising practices or the types of interventions that are out there and that seem to be effective, even though at the time there weren't the best methods for evaluating them. And then just a little bit more context about suicide prevention in the Arctic. And if I recall correctly, they actually interviewed me. There's a small podcast where I answer some questions regarding the nature, the importance of the effort here. And there's some other resources there. If I were to go back to the main landing page, there's also a nice infographic that sort of engages the different potential audience members and the strategies that each of them can utilize with the toolkit. So for example, if you're a clinician or a community member, or a policymaker, or a researcher, these are just a few of the examples of the ways in which the toolkit can be used. So if you're a researcher, for example, using outcomes to inform frameworks or generating research questions. If you're a community member, potentially for improving intergenerational relationships or promoting protective factors. If you're a clinician, improving treatment and evaluation activities. So I think you get the idea. It's really meant to highlight the different ways in which the toolkit is useful. And then of course, there's the toolkit itself, which has the community-based and prioritized outcomes. There's a little introduction about who the target audience is. Again, we have the different sectors, essentially. We have 5 different levels of intervention that were developed by the working group and the scientific advisory panel, talking about individual level interventions or family level outcomes, community level outcomes, clinical outcomes, and even national regional outcomes. And if you were to click on, say, community, it goes to a page where the different outcomes are listed. And in some cases, not all of them, because again, this is one of the first, well, to my knowledge, one of the first attempts at really identifying these outcomes. Some of them will have subsequent hyperlinks to measures. So they refer to, for example, to, you've asked this one here about training, increasing the number of trained and educated community members who understand resources. You can look at modified youth risk behavior surveys, and it gives you at least a first attempt at indicators to see whether or not these outcomes are in fact being achieved. For a number of the outcomes, we do not yet have the appropriate measures, and that's kind of an area that is for future work, for future research. Or I know NIH does fund activities and projects that help to develop and actually vet measures. And I hope that some of those will be coming forward in the coming years. So that's all I wanted to say. There's actually a little video in here somewhere that kind of also gives a little bit of a, so right here, watch this video. There's a short little video that kind of gives you the layout, the content and format of the toolkit. And I hope that those of you who are working in this space, interested in these topics, will explore and navigate through the website at your leisure. You can always follow up with either me or my colleagues at the NIMH. And I'll just leave it at that and take any questions for now. And the rest of the hour we can spend learning about the Alaska Native Health, the ANCHRR, the Alaska Native Collaborative Hub for Research on Resilience.
Hey, Roberto, Jim Allen. Are there any plans to make this a living document and continuing updating with the research as it progresses?
It is meant to be a dynamic, sort of organic website. The key question going forward is who will continue to fund it. So NIH was the original funder for developing the website, for the content, and for providing the information. We're working with the State Department and our international partners about subsequent ways of supporting the site going forward. But yeah, we hope to add to it, not just for blog updates, but additional measures, if possible, to some of those outcomes that were identified through the process. Anyone else? Lisa, I'm curious if you've had a chance to look through the toolkit since you were involved as a scientific advisory group member.
Yeah, so we talked about this a little bit at ICCH in August, and we were sort of trying to see how it can link up to the Finnish chairmanship and to some of the continued efforts that the Canadians have been doing. And I don't know that we actually came together on figuring out how to sort of weave Jim's question in, how it could be a living document given the different directions that the efforts are going. So I think that is a challenge in international work where you have a lot of people voluntarily working together on different projects, and then with such a short-term chairmanship, because it's 2 years and then it switches, and then 2 years and then it switches. And I think the Canadians and the US were closer than I've seen it before as far as like feeding off each other. And then there was kind of a gap. So I'm curious to see how it will funnel into the next conversation with the Arctic Council. And
I agree, because the Finnish chairmanship ends next spring, and then is it Russia, I believe, is the next chair?
No, I think it's Iceland.
It's Iceland. It's Iceland, okay. And then it's Russia. And so Iceland does not have Indigenous peoples, and then Russia has a different view on Indigenous people. So it'll be interesting to see what is able to be sustained over the next few years. But go ahead. Sarah?
No, that's okay.
Go ahead.
Oh, I'm sorry. I didn't mean to interrupt. So this is probably a really elementary question. I'm sorry if people already know this, but so has this been worked through the Sustainable Development Working Group, or what working group within the Arctic Council is this? Has this?
Yes, that was through SDWG. They were the overarching managers.
Okay.
And there's a new head of delegation for SDWG at State Department now, and so it's taken a little bit of time for him to get up to speed on things, and there are all these other challenges as well. Yeah, it's interesting though. Thanks for that. That was very, very insightful. Sure. All right, so we have about just barely a little bit over half an hour. I'd like to turn it over to the team from ANCHRR to walk us through their update progress.
Okay, so that was my cue to pull up the slides, I think. So let's see. I am double clicking. Okay, so can people see the first slide that says?
Yes.
Okay.
Yes, we can see it.
Right. I don't know where Carol went. I only see. Oh, you're here. Okay, so maybe if you start talking, your little picture will show up. We're here to tell you about a new initiative. This is the end of the first basic year. And I think Carol's going to go first. Carol is.
Hi, everyone. Good morning, good afternoon.
So I have a bit of a cold, so hopefully I don't start coughing or you can hear me okay. So I am the outreach coordinator for ANCHRR, and I'm just going to go over and do a brief intro of what ANCHRR is, and also the Alaska Native Community Resilience Study is a huge part of our ANCHRR too, and that's Stacy and Jim will get into more details on our study. So with ANCHRRs, we abbreviate it to ANCHRRs. We're collaborating with 3 regions in Alaska. So there's Yukon, Kuskokwim, Bering Straits, and Northwest Arctic. And we're looking at communities and what the communities are doing to support their youth using strengths-based approach. And in developing, along with that is developing a tool that will be able, communities will be able to use to identify the strengths in their communities and build resilience for our youth. Next slide. So I get to work with amazing people, along with Lisa and Jim, who are presenting as well. Stacy Rasmus is faculty here at the University of Alaska Fairbanks, and she's also the interim director for the Center for Alaska Native Health Research. Yvonne Peter is our vice chancellor for the Native and Rural campus, and Jessica Black is also faculty here, and she's a co-PI for ANCHRR. Next slide. So these are different parts to our ANCHRR. We have the statewide collaborative hub, the executive advisory committee, and the research steering committee. And all of these groups are very important. I'll just go over each one and share a little bit about our different groups. So the collaborative hub is a way for our community members, our stakeholders and our community members in rural Alaska to be able to share success stories from their communities and in this way promote community strengths. The collaborative hub is really building a network with our other entities so we can strengthen resilience and reduce suicide risk. Our annual meeting, we had our first annual meeting in April, and we were very fortunate to be able to bring about 100 people together. We partnered with the Northwest Alaska Wellness Initiative, and it was an amazing first gathering where we had stakeholders from across the states. A lot of rural community members came in to share their work, and it was powerful for us to be able to hear stories from across the state. And we're starting to prepare for our next gathering, which will happen in March in Nome. So excited about that. Our executive advisory committee is headed by Yvonne Peter. He is our vice chancellor for rural community and Native education, like I said before, and he is very involved with ANCHRR and very involved with our leadership team. This committee there's representatives from across the state of Alaska. We have representatives from the president of our only tribal college in Alaska, which is Ilissalvik College in Barrow. And then we have leaders from across the state, Alaska Native Owned Corporation, health and community organizations across the state. So this group is really looking at a big picture of what the research in Alaska is doing for Alaska Native people. And this advisory council is not just, it's not just ANCHRR, but it's actually an advisory council that is really working with our institution and our state they're like at the policy level change, and they are going to help, really guide, advise us with Alaska Native people and research. The research steering committee is, and our EAC, or Executive Advisory Committee, has 8 members currently, so it's a big group. Our research steering committee has about 17 members, and this group, we meet once a month, and This group is representatives from across the state, actually representatives mainly from those 3 regions where we are doing the study. So we have community members and stakeholders that are focused in those 3 regions, like I mentioned, Yukon, Kuskokwim, Bering Straits, and Northwest Arctic. And they're really working hard to ensure that the Alaska Native Community Resilience Study, or ANCHRRS, is responsive to community needs, making sure that research is conducted in a way that's going to be useful for communities and our rural communities there. Next slide. So ANCHRRR, overall, you'll see the goals of ANCHRRR on the screen there. And really, we are working towards establishing, like with our collaborative hub, establishing central communication networks. So there's so many wonderful, powerful things going on in our state. And for us to be able to reach out and gather people together and share what is being done is going to be powerful for all our communities. And, the shift towards looking at the strengths of our communities and what are people doing to create resiliency in their communities is powerful. It's, it switches the conversation to something positive, and that brings hope to our Alaska Native communities. You can see it, we could see it at our collaborative hub gathering. You could see the hope. The people just, it was powerful. So the photo there is one of the photos. This was the opening of our collaborative hub gathering, and that's the chief from Minto, Luke Titus, and he's leading our group up into the space. And it started out where, we went in with drumming and song, and we were able to create a space for everyone to be comfortable and able to share. Next slide. So this is just the indigenous groups of Alaska. And if you look at the map, the groups that were where the focus is currently is the Inupiaq and Central Yupik region, and the west, north and west, central west of Alaska. So we have groups, the language, Inupiaq language and Yupik language is very strong in these communities, is actually very strong in the Yupik communities. Many of the youth are speaking, and there's a lot of immersion programs happening with the Inupiaq communities as well. So that's important to be able to connect with these communities, and all of our researchers and the PIs have strong connections with these communities. So we're able to go in and really get connected with these groups. And you could just see the diverse groups across Alaska. And there's so many different languages, different dialects, and it's powerful to be able to bring all these groups together like we did with our collaborative hub gathering. And there's so many similar stories between these different groups. We have, we get excited, and the communities get excited because they can share, and like, wow, this is what we're doing, or we have this happening in our community. And so the excitement really builds with being able to share with all these different groups across the state. So I'm going to turn it over to Lisa Wexler, and thank you all.
Thanks, Carol. Okay, so I'm going to talk about ANCHRRS, the study that we're doing as part of the Alaska Native Collaborative Hub for Research on Resilience. It's a complicated process, doing research across 3 regions. There are many communities within those 3 regions, so we're targeting 65 communities to work with. And one of the reasons why is because each community is significantly different. This slide shows suicide rates. It's a little bit old, but it shows how they're not ubiquitous across all different regions of the state, and that's true when you get to a community level. So there are differences that we don't understand necessarily, that we've done a lot more studying of the risk and what increases risk for communities, but not a lot of understanding and research has gone into figuring out what's going right and why are some communities having very much lower rates than others. So we are working in the 3 regions where both Jim Allen, Stacy Rasmus, and myself, the 3 PIs on the project, have worked in the past. We have decades of experience working in the 3 regions with the highest suicide rates currently. And again, when you put all of the people from the many different communities into a region and get rates that maybe hides some of the strengths that we are looking for specifically in this research project. So we are working in Northwest Arctic, we're working in Bering Strait, or in this graphic Norton Sound region, and in YK, in the Yukon-Kuskokwim Delta, in those communities that are 100 people or more. And what we're trying to understand is what are the community level factors that increase protection and decrease suicide risk. So this work was first inspired by the many communities that we've worked with over the years, insisting and suggesting that we focus on what's going right and the strengths that communities do have and the ways in which they have responded to a whole host of particular stressors that have happened over the last 100 years, over the last 50 years in those communities. It's within that time frame that we have begun to see youth suicide as something that needs to be addressed. And so, and I think I've lost count on the slide numbers. So, so we are trying to better understand what's going right. So I wanted to tell you a little bit about specific aim 1, and I think I'm going to turn it over to Jim, I think, in the next slide. But really what we're trying to do is understand what community level factors are associated with reduced suicide risk. And what we mean when we say reduced suicide risk, we mean deaths, we also mean alcohol-related injuries, and other kinds of outcomes that are associated with suicide risk. We have built the study on Chandler and Lalonde, a study that they did. There's many different versions of this study that started being published in 1998, I believe. But basically, it's the most quoted suicide prevention research from Indigenous communities. And I think that's because the heuristic is a good one. Basically, they're looking at what community level factors, and they were looking really broadly, and they were using administrative data to figure this out. So there are things that we want to make better about this work. But they were looking at self-governance and land claims and education, and you can read this list. And they basically identified factors, and they were able to show just correlational relationship between these administrative factors that they called cultural continuity. That showed self-determination, that showed cultural continuity, so language revitalization or sustainment, and a reduction of suicide risk. So what they were able to show was that increased, or communities that had the highest numbers of these factors in place correlated with lower suicide risk. And so we are working to try and reproduce that, but reproduce that in a way that is much more closely aligned with what community members think matters at a community level. And so this slide is looking at pilot work that I did in a region of Alaska, where we were trying to understand what those Canadian factors might look like in an Alaska Native community. So we looked at ongoing cultural activities, were they happening and how much? Whether people that were living in the communities felt like they were able to access healthcare that worked for them. We looked at schools and how open they were to community members getting involved and being involved in the education of their children. We looked at law enforcement and whether or not there was law enforcement in place. As you all know, a lot of the smaller communities have spotty law enforcement that they can access at a community level. We looked at local option laws and whether or not they were enforced and how they were enforced. And then we looked at people's understanding of their government and how well they were functioning. And we found some correlational relationships between the number of those factors and protection for suicide risk. And that's kind of where we started this study that has gone through some iterations. We've asked a lot of guidance from different levels of communities. So you saw our executive board is very high level, looking sort of at policies, looking at institutions, all the way down to people that are living in those communities. So I'm going to hand it over to Jim to talk about the specifics of the first aim of the Alaska Native Community Resilience Study. Take it away, Jim.
Thank you. And I will go through this pretty quickly. It's about quarter to the hour right now. So in 4 minutes, I'd like to talk about some overarching ideas around the first aim of the study, and then a few of the specifics. And we'd be most happy to answer any questions at the end of our talk. We had a meeting at McGill University before really doing some fine-tuning on the study. And one of the reasons we did this is this Chandler and Lalonde study was published in Transcultural Psychiatry. Lawrence Kermeyer was the editor. And we were really interested, despite its enormous citation rate, it also is criticized roundly by a number of people, both for methodological problems and some problems with conceptual clarity. Well, what we wanted to do through this study is essentially do a replication that responded to a lot of the critiques in the best way possible. And so one of the first things that did come up is that it's really not, many people thought it was really not a study about cultural continuity per se, although that was one part of it, but it was much broader. And it could be maybe more accurately described as what they were interested in studying was indigenous community level resilience, or perhaps protective community factors from suicide that were facilitative of community well-being. So the advice we got is not to try to repeat everything Chandler and Lalonde did, because essentially they just went and used data that was existing that they could latch on to fairly easily, and it was publicly available. We were going to actually construct an interview. And let me tell you a little bit about this interview, which will be largely what Aim 1 is about. We're going to go to 64 communities. We're going to interview 3 to 5 local community experts nominated by each of the communities. And through this interview, we're going to try to get a portrait of the status of these strengths in each of the communities. And on the top, you see in the slide, these protective community factors, and to the right, in the grant application, we laid out hypothesized mechanisms by which these factors work. And the mechanisms, of course, become things that preventative interventions could to focus upon. Next slide, please. So the first area, which was a large part of what Chandler and Lalonde called cultural continuity, really was about accessible and culturally responsive services across the areas from criminal justice to education. Next slide, please. We also, in our interview, we are asking about what we call community development, which is opportunities and also accountability of community institutions in terms of young people and people who support young people. Next slide, please. A big part of what Chandler and Lalonde tried to tap was this idea of local control and self-determination. And next slide, please. And then finally, what we are calling cultural continuity in this, this effort involves specifically supports of subsistence, decolonization efforts, tribal language use, and then intergenerational mentoring. Very interesting thing happened with our research steering committee. They looked at all these things and they said, this isn't enough. This is missing a very important part of indigenous resilience. Next slide, please. And that was spirituality and religion, a very difficult thing to try to evaluate and assess. And they were also, I think, quite courageous. They insisted that they wanted an understanding both of traditional spirituality and other religious practices, including Christianity. Next slide, please. And the aim one is going to seek to build a predictive model, a regression model, where we will look at these various dimensions of community resilience. And what we're going to attempt to do is see if they predict things like suicide death, attempt, and in addition, accidental death and injury, and alcohol-related injury requiring treatment. And what we hope through ANCHRR, the Alaska Native Community Resilience Study, is to change the narrative from risk to hope through exploration of protection, strengths, and resilience. Next slide, please. And over to you, Lisa.
Okay. So briefly, the way that we are going about doing this, as Jim mentioned, is a conversation with people living in the communities. And we'll be able to see how these different factors work and which ones are most related to a reduction in risk, as was described. And so we wanted to share some of those questions with you, and we thought we might have a little bit more time for comments or questions in order to sort of give you enough to speak to or to ask about. So we wanted to share some representative interview questions. Another thing that changed from when we proposed this work to when we worked with our steering committee to get to the place where we're doing data collection is the interviewers. So we had originally thought that we would have students at UAA, University of Alaska Anchorage, and Fairbanks doing the interviews from those basically big cities in the state, and have shifted to working with students who are sort of non-traditional students, meaning they're older, they're from the communities that we're going to be working with. So they're from the Yukon-Kuskokwim Delta, they're from Bering Strait, and they're from Northwest Alaska. And they're in a certificate program, so they're in the Rural Human Services Certificate Program, and they will be our primary interviewers. So they will be calling and asking questions like, does your community have an active community group working towards wellness? Or do your community leaders have open meetings and listen to the public when they're making big decisions? And so they will be our primary data collectors in this. And we've really had to think about how to structure that interview, how to ask those questions, and how to make sure that, that it's done in a respectful way. So it's taken our first year to get guidance from those different levels of guiders, especially the Research Steering Committee, in order to get our structured interview in place. We've done some focus group testing on that. We've also done interviews with people who are in key positions in the 3 regions in which we're working. Next month, we're going to be doing a 3-day interviewer training. We're also, through this work, we're trying to build local capacity to do research and to make sure that research is responding to local needs. And so getting more Alaska Native community interviewers and researchers involved in this is a big part of what we're doing. And so we are expecting to have 12 Alaska Native people from rural communities involved in this research as researchers. And we'll be doing that training next month. And then for the next 7 months, we will be working with them to contact people within the communities and asking them to help us understand the level of these resilience factors that we have in place. And so that's a lot of information. And I'm wondering if folks on the call have questions about either the progress that we've made, the changes that we've made, or the work that we're doing.
This is Grant, Rich, and Juno. I want to thank everyone for their really valuable presentations and significant work. I'm a big advocate and champion of these projects. I guess I can add from the point of Juno just kind of a piece of information right now when I'm looking at these qualitatively developed questions. This is the time of the year in the state of Alaska where we develop our every other year URBIS, the youth-oriented risk questions. And in fact, September 5th was the statewide meeting to add statewide questions. You may find them an interesting point of intersection with your own local data. And I just want to let you know that that opportunity is like right now. So reach out to Andrew Finetti, a psychologist who supervises the URBIS and the BURFIS. The URBIS AK coordinator is Taz Mannix, and the BURFIS, the Adult Risk Factor Survey, comes out of the CDC. The new AK coordinator is Sam Hydrell, and who's a PhD in biology, I think. But you may find that data interesting point of comparison to connect and contrast with your own project.
Thank you.
Grant, that would be enormously helpful. We didn't get a chance to talk about this, but we have recently received a supplemental whose intent is to actually look at that kind of existing public data and see what is harvestable that might be easier ways to access indicators of community level resilience. So thank you.
Yeah,
Yeah,
and Matt Berman, I just wanted to throw out his name because he's heading up that effort.
You might want to take a look at the optional 2019 CDC questions on connectedness were asked in the 2017 URBIS, but are optional this year. So if you're one to advocate for a series of questions on student connectedness, such as, do you feel alone in your life? Do you have one or more adults to talk about? Those kinds of questions. And, James Galanos, who was our suicide prevention coordinator for 10 years here at State of Alaska DBH, was a big advocate for those, and sadly he's departed for Colorado. So I just want to get the word out there that that opportunity is there, but you need to seize the day.
Great, thank you.
Thank you, Carol, Jim, Lisa. Does anyone else have a comment or question to that? If not, I just have a quick question regarding the community engagement aspect of it. And for full disclosure, when I was still at NIH, I was the project scientist on this collaborative agreement project. So I'm very excited to see that the immense progress that is going forward. But my question, because you are working so broadly across the state, 64 villages, what has been the response by different communities with respect to how you're introducing the project, for anything related to suicide, can be sensitive or potentially stigmatizing? What has been the response, or what has been your strategy for engaging the communities and introducing the project and going forward?
That's a great question. So we have many different layers to that question, or many different answers to that question. And so maybe I'll do my short bit and then invite Carol and then Jim to weigh in. So, so part of the engagement involves the Research Steering Committee, which with members from all of those regions who sort of weighed in on that. We've also been working with different tribal reviews to get permission and approval in order to do the data collection. As I said, we haven't started that yet, but we're doing the training of interviewers next month. And so we're in a process of getting those tribal reviews. We sent letters out to the tribes to make sure that they're aware of the work that we're doing. And when we have been doing sort of just measurement development. We've been doing a lot of conversations with people who are involved in different aspects of suicide prevention and different aspects of community wellness in the regions. So Carol, I don't know if you want to say anything more about that.
I think just, the piece of the collaborative hub too, and that, the communities that are coming together and learning about ANCHR and then sharing that information with community members to be able to get out what ANCHR is doing and what our goals are. And so that's really important to have that engagement with the communities across the state as well.
Good point. Jim?
Yeah, I just want to point out that one of the things Carol will be doing is leading an effort where we reach out to leadership in each of these communities. And so there's a significant educational outreach component to doing this research. And I think that's really crucial, and a number of us vision the possibility of really the potential to change the narrative from these what have traditionally been risk-based frameworks and what is wrong to what communities are doing, have been doing, and what if you look back at the data and the epidemiological variation between communities, a lot of communities are doing very important things that are right. And changing the framework of research to a focus on this, I think, will be a really important part of what you alluded to, Roberto, this work in this very sensitive area. Right. And I think it really is an important question. Can we start doing research that no longer stigmatizes communities, but really portrays many of the strengths all of us observe in these communities, and using that as a catalyst for suicide prevention? Well, back over to you.
Great. So I see we're into the 3 o'clock hour. I really want to thank Carol, Jim, and Lisa again for this excellent update on ANCHR. We look forward to additional updates on the progress for the next 4 years. So that's a indirect invitation to present again after next year. And I'll just close by saying that our next collaboration team meeting will be on Tuesday, October 16th. And the theme around that meeting actually will coincide with the quarterly One Health meeting, CDC and Alaska Native Tribal Health Consortium lead. I don't know if Tom's still on the line, if you want to add anything to that. If not, then again, thank you.